We all strive to keep balance in our lives, but when our ability to keep physical balance becomes impaired, it might leave us feeling dizzy or unbalanced. A study conducted by the Massachusetts Eye and Ear Hospital showed definitively that after age 40, our ability to balance starts to go downhill. And with each passing decade, that downhill slide increases another 83%. Our ability to balance, otherwise known as our vestibular function, substantially impacts our risk of falling. However, there are tests that can help. The specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery explain how they go about searching for the underlying causes of dizziness and balance impairment using their vestibular testing.
Vestibular is actually a system within your body, and that component comprises of the vestibular nerve in the inner ear, and affects your eyes, your brain, your strength and extremities. The physician may notice through their evaluation the patient's inability to perform certain exercises or walk properly, and then that would lead to other questions from the physician.
Dizzy is a very broad term, and we often like the primary care doctor to have evaluated the patient from a dizzy standpoint, because it can be something cardiac or neurological in origin, and that probably needs to be looked into or ruled out beforehand.
If the physician determines or suspects certain issues in balance, then that's where that would trigger an order for vestibular function testing.
So we've taken that audiological services into the vestibular lab and then incorporated ENG testing, which also kind of helps us better diagnose the type of problem with the balance system and equilibrium.
I primarily perform vestibular function tests for patients suffering from dizziness, and that's used to detect what's called a nystagmus. A nystagmus is an eye twitch or an eye move that is commonly associated with dizziness. And that's just a reaction. Everyone gets it. And then you use that nystagmus to analyze where the dizziness is coming from. 50% of people suffering from dizziness is going to be an inner ear issue or otologic issue. For the most part, the way that you treat and fix some inner ear disorders are done through what's called vestibular rehabilitation. That is a type of physical therapy performed in order to realign or break up different, what some people call debris or rocks in the ear.
For more information on dizziness, as well as links to the specialists at Lake Ear, Nose, Throat, and Facial Plastic Surgery, please click the Off Balance story link icon on our homepage at yourhometownhealth.com.